Mariah, First Edition begins this half hour looking at the difficulties of finding proper mental health counseling in the United States.
That's right. Services were hard to come by for many people long before the pandemic began. However, after 2 years of unrelenting stress, turmoil, and grief, many people seeking help are confronting a system that is at or beyond capacity. Many are looking for help only to be stuck on waiting lists. Assistance of any kind is in short supply in rural areas where all healthcare choices are more limited there than for residents of cities and urban areas.
When the American Psychological Association surveyed its members last fall, they found 65% of their psychologists said that they were not able to take on new patients. 68% said they thought their lists were longer than they were back in 2020.
Dr. Salim Surani is joining us live to discuss this further. Dr. Surani, it's so great to see you. We've talked over the last 2 years about healthcare in general and the mental strain on nurses and doctors, but there's also the patient, the person that's looking for that help. It's even more difficult to find, especially a doctor that's willing to even meet with you in person. What are the big challenges you see here?
Good morning, John. I'm glad to be here. This is one of the major challenges which is going to be facing our nation. Even before the pandemic, we had a major crisis. We had severe shortage of the mental health care providers and the physician. The patients had a tough time in trying to get to them. And now with this pandemic coming in, the inflation on the rise, I think we are going to see this more pronounced. The schools were closed. So not only the adults were affected, but also the children were kind of suffering with that. And if we know that there is only like 8,300 child psychiatrists for at least 15 million kids, so I think that's a big amount of population which this small number of psychiatrists can cover. That's a major challenge. And plus the school shut down over the period of time, and the lack of interaction between the kids and the other kids, these are all going to keep on mounting. And second thing is, the most important is that initially the mental health was considered as a stigma. Now the mental health is not considered, and we have made a lot of good work in that area, trying for the patients to come forward and be recognized and treated. And that's just like any other disease like high blood pressure or diabetes. So the people are coming forward, but at the same time, on the back end, it does have a significant shortage of the healthcare providers.
Okay, and this is definitely something that many adults have to weigh, putting food on the table or paying for something they know they need to address. You're going to be discussing a lot further with Barbie the children component to this and the challenges of making sure that you're having proper conversations with them and addressing those mental health needs and why we need to get past the stigma. Dr. Surani, always a pleasure. And if you do have a question for Dr. Surani, send us a text at 361-855-6397. We will be talking about mental health today. And speaking of which, if you or someone you know is exhibiting signs of suicide or depression, there are resources that can help out. You can call or text anytime during the day. The National Suicide Prevention Lifeline. That number is 1-800-273-8255. It's on your screen right now. Counselors are available 24/7. There's also a line that you can text. You can text NAMI or HELP to 741-741. And here's a great thing. There's also several resources here in the Coastal Bend, including the Nueces Center for Mental Health and Intellectual Disabilities, the Coastal Bend Wellness Foundation, and the Family Counseling Services in Corpus Christi and Kingsville. Those numbers are on your screen. There's a lot of numbers there. We understand. All you need to do is go to our website at KIITV.com for that list.